Hello there, welcome once more to this YouTube channel. Kindly subscribe to this channel. The topic is medical imaging of the head. Let me start with radiography. Radiography is an old imaging modality. Though you have newer imaging modalities, but radiography is still commonly used for cranial examinations. The common radiographic projections are lateral, posteroanterior, anteroposterior, and axial. The cranial have that's the cranium in various persons vary in shape, so you really need to do thorough radiographic examinations for you to appreciate abnormalities of the cranium. You have several pathological conditions that could make the head to enlarge, like hydrocephaly. Some other conditions could make the head to be small, like microcephaly. So all these conditions can be appreciated when radiographic examination of the cranium is done. Lateral radiographs are often made to examine the calvaria, but they can also be used to examine structures in the cranial base. The facial skeleton in adults forms about half the cranium, but in children the facial area is smaller. The calvaria in adults vary from 3 to 8 millimeters in thickness, but the cranium is much thicker around the external occipital protuberance. So you can appreciate with medical imaging, you can appreciate all this. For examination of the orbits, as well as the nasal region and certain paranasal sinuses, anteroposterior radiographs are quite useful. Right here is an illustration of anteroposterior radiograph of the skull, as well as lateral radiograph of the skull. Now let me talk about computed tomography. Computed tomography is premier imaging modality that's useful in neurodiagnosis, that's diagnosis of neural abnormalities, and it offers you more information than you have with plain radiography. But for want of cost, it's more expensive than the plain radiograph. We still like CT, because when you talk about the cost, the speed and availability, a CT is quite useful for evaluation of head injury. CT is useful for people who are neurologically and medically unstable. People who are uncooperative also can be examined, and then people who are that have pacemakers or other metallic implants also can be examined. The diagnosis of extradural, that's epidural hematoma, can be made by CT. When the injuries are severe, the meninges and cerebral cortex could be torn, and you will appreciate that with you can see that diagnosis with CT. Traumatic hemorrhages often produce hematomas in the cerebral hemispheres, basal ganglia, and brainstem. So with CT, you can appreciate all that. Right here is CT's cross-sectional imaging. Right here is an illustration of an axial section of through the brain, as seen with a CT scan. So it's shown right here. Now let me talk about magnetic resonance imaging. Magnetic resonance imaging, MRI, is slower and more expensive than CT, but it shows more detailed. It shows more details as far as the soft tissues are concerned. So it offers more details than you have with CT. MRI is the gold standard when you want to diagnose intracranial and spinal lesions. when you consider the soft tissues, it gives good contrast. You see a very good contrast of normal and pathological structures. You can appreciate all that with MRI. It also permits multiplanar capability. Planar capability, and this provides three-dimensional information and relationships. You cannot see this with CT, but you can see that with the MRI. MRI can also demonstrate blood and cerebrospinal fluid flow. MRI, there's what we call MRI, magnetic resonance angiography. This is quite useful when you want to determine the patency of vessels, the blood vessels that you have in the cerebral arterial circle. Acute occlusions of major blood vessels in the cerebral arterial circle and the basilar artery are detectable with the aid of MRI. But when you have occlusion of small blood vessels, it's not easily observed with MRI. So that one appears to be a shortcoming. Right here is an illustration of magnetic resonance imaging. The scan, you have a cross section of the brain is seen right here. Ultrasonography is one imaging modality that I must talk about now. Ultrasonography. You must remember that because of the continuous layer of peripherally located bone, ultrasonography is commonly used for evaluation of the head once ossification of the frontanels has occurred. So once ossification of the frontanels has occurred, ultrasonography is used for evaluation of the head. Ultrasonography is useful in evaluating subepidermal and intraventricular hemorrhage, particularly in high-risk premature infants, and you need to examine them with ultrasonography, and you need to really monitor for likely development of hydrocephalus. Ultrasonography requires minimal manipulation of critically ill infants, so it's quite useful in infants. Right here is an ultrasonographic image of the head. Thank you so much for listening. Goodbye for now.